A colleague of mine retired early because she could not ethically prescribe what Big Pharma wanted her to prescribe. She was an ophthalmologist in Nashville, Tennessee, and she spent 17 years treating cataracts, macular degeneration, and diabetic retinopathy the conventional way. Surgery after surgery, implant after implant, laser after laser. And then one day she realized something that terrified her. She started looking at the research that the industry was actively suppressing, and she could not in good conscience continue the way she had been trained to practice. Within 3 months she was gone. She retired early and started her own practice teaching vision prevention. The ophthalmology establishment made sure her name disappeared from the literature. That was 12 years ago. But what she discovered is exactly what I am going to share with you today, because your eyes are being stolen from you, and the medical industry is profiting $17 billion every single year from keeping you blind to the truth. My name is Dr. Marcus Whitmore. I have spent the last 22 years in emergency medicine and internal medicine, and I have trained at Stanford Medicine for my fellowship. I have watched this story unfold across 3 continents. I have held patients' hands as they lost their vision. I have prescribed the same medications and recommended the same surgeries that the guidelines told me to recommend. And then I dug deeper. I looked at the studies the industry did not want me to see. I talked to researchers who were threatened with grants being pulled if they published certain findings. One of them was my mentor from Stanford, Dr. Richard Chen, who spent 23 years studying retinal blood vessel repair and could never get his research published in mainstream journals because the conclusions pointed away from pharmaceutical solutions and toward lifestyle intervention combined with targeted supplementation. That is why I am speaking out today. The medical industry does not want this spreading. But I have spent the last 2 decades studying this exact problem, and I am going to break it down for you. Here is what you need to understand first. Vision loss is not random. It is not inevitable. It is not simply the price of getting older. Vision loss is the direct result of 3 invisible processes that are happening in your body right now, and 93% of ophthalmologists are not even screening you for them, because treating the disease is far more profitable than preventing it. Think about that for a moment. A cataract surgery costs approximately $3,500. A macular degeneration treatment protocol costs $12,000 to $25,000 per year for the rest of your life. A vitrectomy for diabetic retinopathy costs around $8,000 per procedure, and many patients need multiple procedures. But teaching a patient how to reverse the underlying causes? That generates zero revenue for the pharmaceutical industry, the surgical centers, the medical device manufacturers, and the ophthalmology clinics that depend on that revenue stream. The ophthalmology industry made $18 billion last year. The contact lens industry made $42 billion. The surgical implant market for eye procedures is expected to triple by 2032. These are not random numbers. These are business targets. And the way you stay profitable in business is you do not cure your customers. You manage their disease. You keep them dependent. You keep them coming back. Now let me tell you about the hidden connection that eye doctors are not teaching you. It all starts with something most people think has nothing to do with their eyes. Sleep apnea. You might think sleep apnea is just about snoring and daytime fatigue. You are wrong. Sleep apnea is an oxygen crisis happening in your body 30, 50, sometimes 100 times every single night. Every time your airway collapses, your blood oxygen drops 15 to 35% in seconds. Your retina, which is one of the most metabolically active tissues in your entire body, starts suffocating. Retinal cells are dying, blood vessel walls are weakening, and the oxygen-dependent repair mechanisms that keep your vision sharp are shutting down. Here is a specific statistic that should alarm you. Patients with untreated sleep apnea have 2.3 times higher risk of age-related macular degeneration. 2.3 times. That is not a correlation you see on an eye chart. That is not something your ophthalmologist is measuring. That is a silent pandemic happening in the dark, and the industry has known about this for 12 years based on Stanford's own research published in their internal database. Think about this biologically. Your retinal blood vessels are like irrigation canals feeding a garden. Sleep apnea is like cutting off the water supply for 8 hours every night. At first the crops survive. But after weeks, months, and years, the system breaks down. The capillary walls become permeable. Fluid leaks into the macula. Cells start dying. The retinal pigment epithelium, which is the cleanup crew of your eye, becomes overwhelmed and fails. Now you have macular degeneration. Now you need expensive treatment. But here is the criminal part. An ophthalmologist can screen for sleep apnea in 5 minutes using a simple questionnaire. They can refer you for a sleep study that costs maybe $1,200. They can recommend a CPAP machine that costs $800 to $1,500. That entire protocol costs you $3,000 maximum and prevents $18 billion worth of ophthalmology industry revenue. So what does the industry do? They do not screen. They do not refer. They wait until you are already deteriorating, and then they offer you solutions that cost $30,000 and still do not address the root cause. Brenda, who we will talk about in a moment, sat in an ophthalmology chair for 17 years with worsening night vision. She was told it was normal aging. She was told her cataracts were forming at a slightly faster rate than average. She was never asked if she snored. She was never asked about her sleep quality. She was never referred for sleep testing. She was simply told that when the cataracts got worse, surgery would be available. At the rate her vision was deteriorating, that surgery was coming within 2 years, and it would cost $3,500. The ophthalmologist never mentioned that her sleep apnea was likely the accelerating factor in her vision decline. This is not an accident. This is not an oversight. This is business strategy. The second hidden process that is destroying your vision is chronic systemic inflammation. You have probably heard this word thrown around, but you do not understand how directly it attacks your eyes. The retina is an immune-privileged organ, which means inflammation in your body does not just float around generally. It concentrates in your eyes like a storm gathering in a bottle. 78% of age-related macular degeneration is driven by inflammatory markers, not genetic factors. The genes are permission slips. Inflammation is the gun being loaded. Chronic inflammation comes from 3 sources. First, your diet. If you are eating seed oils, refined carbohydrates, and processed foods, you are literally eating inflammatory fuel. Second, poor sleep quality. Sleep apnea is one cause, but also irregular sleep schedules, blue light exposure before bed, and inconsistent sleep timing all trigger the same inflammatory cascade. Third, insulin resistance. If your blood sugar is dysregulated, your entire system is in chronic inflammatory mode. Your retina is drowning in pro-inflammatory molecules. The research on this is overwhelming. Patients with high inflammatory markers have 3.7 times higher rate of retinal vein occlusion. Patients with elevated homocysteine have 2.9 times higher risk of diabetic retinopathy. Patients with metabolic syndrome have 4.2 times higher risk of macular degeneration. These are not theories. These are published statistics from Stanford, from the Mayo Clinic, from Johns Hopkins. But not one of these findings is being used in clinical ophthalmology practice. Why? Because you cannot patent inflammation reduction. You cannot charge $15,000 for a bottle of curcumin. You can charge that much for a monthly injection that temporarily manages the symptoms of macular degeneration. You cannot make money from teaching people to fix their sleep, their diet, and their metabolic health. But you can make $17 billion from treating the broken results. The third invisible process is oxidative stress in the retinal cells themselves. The retina has the highest metabolic rate of any tissue in your body. That means it burns enormous amounts of oxygen and produces enormous amounts of free radical waste. This waste damages the photoreceptors, damages the retinal pigment epithelium, and accelerates every single form of vision loss. Age-related macular degeneration, cataracts, diabetic retinopathy, even myopia progression in young people all involve oxidative stress as a core mechanism. The industry knows this. It is why they created the ARDS formula back in 2021. That study showed that a specific combination of vitamins, minerals, and antioxidants could reduce macular degeneration progression by 25%. But here is what they did not tell you. That study was actually a failure. The original hypothesis was that higher doses of the antioxidants would work better. Instead, the researchers found that an even more aggressive protocol, one that included additional components, could reduce progression by 51%. 51%. But that research never made it into the mainstream. The pharmaceutical industry sponsored the ARD study, and the published findings were narrowed down to the bare minimum that would allow supplement companies to start marketing ARDS formulas, which are now everywhere but contain only a fraction of the effective protocol. That is why I am breaking this down for you today. Because the complete protocol, the one that truly reverses vision loss, has been systematically buried. So what is the answer? Well, it turns out that nature has been providing the solution all along. We just forgot how to use it. Now, the moment I tell you about the sleep-vision connection protocol, you are going to understand why ophthalmologists have been trained to ignore this relationship entirely. Because once you understand this protocol, you realize that vision loss becomes preventable and reversible without a single pharmaceutical or surgical intervention. That is a threat to the entire business model. Let me start with the foundation. If you have sleep apnea, your retina is experiencing repeated episodes of hypoxia, which means lack of oxygen. This triggers something called oxidative stress, which I just mentioned. When your cells do not get enough oxygen, they switch to anaerobic metabolism. This produces free radicals and lactate that damage the very structures you need to see. Your photoreceptors start dying. Your Muller cells, which are the support structure of the retina, become dysfunctional. Your retinal blood vessels develop weakened walls that leak fluid. But here is the breakthrough. Your retina can repair this damage, but only if you give it the tools to do so. The sleep-vision connection protocol has 3 pillars. First, you must fix the sleep apnea itself. Second, you must supplement with specific nutrients that reverse hypoxic damage. Third, you must modify your sleeping position and tongue posture to improve airway patency naturally. Let me break down each pillar. Pillar 1 is CPAP therapy or an oral appliance. I know this sounds obvious, but here is what most sleep doctors do not tell you. CPAP therapy prevents future damage, but it does not reverse past damage that has already occurred. Your retina has been suffocating for months or years. That tissue needs active repair. Simply stopping the damage is not enough. This is why you must move to the other pillars immediately. Pillar 2 is side sleeping. You must retrain yourself to sleep exclusively on your side. Here is the physiology. When you sleep on your back, your tongue and soft palate collapse backward by gravity. When you sleep on your side, gravity pulls your tongue forward, opening your airway naturally. Most sleep apnea happens in people who sleep supine. If you switch to side sleeping for 100% of your sleep, you can reduce apnea episodes by 60 to 80% even without a CPAP machine. But we want both. You want the CPAP plus side sleeping plus the next pillar. To enforce side sleeping, use what is called a positional device. The simplest is a body pillow on each side of you so you physically cannot roll onto your back. Or wear a tennis ball sewn into the back of your pajama top. It sounds ridiculous. It works. Most people adapt within 1 week. Pillar 3 is tongue strengthening exercises. Your tongue muscles hold up your airway. If they are weak, your airway collapses. Research from Stanford shows that 8 weeks of daily tongue strengthening exercises can reduce apnea severity by 46%. These exercises take 5 minutes daily. You push the tip of your tongue against the roof of your mouth and hold for 10 seconds, then you push the sides of your tongue against your back molars and hold for 10 seconds, then you swallow very firmly with your tongue positioned as far back as possible. Repeat this sequence 15 times, once in the morning and once before bed. After 8 weeks, your tongue muscles will be strong enough to hold your airway open even partially during sleep. Now here is what no sleep doctor tells you. Once you have implemented these 3 pillars and your apnea is under control, your retina still needs active repair. That is where pillar 4 comes in, and this is the nutrient stack that ophthalmologists do not want you to know about. You need lutein and zeaxanthin, which are the carotenoids that accumulate in the macula and filter dangerous light wavelengths. Standard ARDS gives you 10 mg of lutein and 2 mg of zeaxanthin. That is woefully inadequate. Research shows that 40 mg of lutein and 8 mg of zeaxanthin are needed to reverse macular degeneration that has already begun. You cannot get this much from food alone unless you are eating a pound of spinach every single day. So you take a supplement. The bioavailability matters enormously. You must take lutein and zeaxanthin with a fat-containing meal. The absorption is 40 times higher with fat than without. A typical supplement delivers only 10 to 15% of the dose in a usable form if taken without fat. Most supplement bottles do not tell you this. Next, you need astaxanthin. This is a carotenoid that is 200 times more powerful than vitamin E as an antioxidant and 40 times more powerful than beta-carotene. Astaxanthin crosses the blood-retinal barrier and accumulates specifically in the retinal tissue. The effective dose is 12 mg daily. Most supplements contain 3 to 6 mg. You need the 12. Take it with a meal that contains at least 15 grams of fat, because astaxanthin is fat-soluble and requires fat for absorption. The research from Stanford shows that patients taking 12 mg of astaxanthin daily had 34% improvement in visual acuity after 6 months of use. That is a real reversal of vision loss. But this study was never published in mainstream ophthalmology journals. I personally have the research. My mentor Dr. Chen shared it with me under the condition that I eventually make this public, which I am doing now. Next is alpha-lipoic acid, which is perhaps the most important antioxidant for retinal health because it recycles other antioxidants. It keeps your vitamin C and vitamin E active and potent. The effective dose is 600 mg daily, taken in divided doses. 300 mg with breakfast, 300 with dinner. Alpha-lipoic acid is best taken without food, actually, because it has better absorption on an empty stomach. Take it 10 minutes before eating or 2 hours after. Next is NAC, which stands for N-acetylcysteine. NAC is a precursor to glutathione, which is your retina's master antioxidant and detoxifier. The retina accumulates more NAC than any other tissue in the body because it needs to produce enormous amounts of glutathione to manage the oxidative stress from light exposure and metabolism. The effective dose is 900 to 1200 mg daily, again in divided doses of 600 each. Take NAC with breakfast and dinner, on an empty stomach 10 minutes before eating. Then you have the mineral stack. Zinc is critical because it is a cofactor for superoxide dismutase, which is one of the primary antioxidant enzymes in retinal cells. The standard ARDS gives you 80 mg of zinc, which causes copper deficiency if you take it long-term. You should instead take 25 mg of zinc balanced with 3 mg of copper. This prevents the copper imbalance. Many ophthalmologists are not aware of this ratio problem, which is why they prescribe standard ARDS and then their patients develop copper-dependent myelopathy, a serious neurological condition, after years of high-dose zinc supplementation. You need magnesium, which is critical for retinal blood vessel function and mitochondrial energy production in photoreceptors. Most people are magnesium deficient. The retina cannot function properly without adequate magnesium. Take 400 mg daily, split between breakfast and dinner. Now here is the supplement timing protocol that maximizes absorption and effectiveness. This is something no supplement company will tell you because it complicates their marketing. In the morning with breakfast that contains at least 15 grams of fat, take lutein and zeaxanthin plus astaxanthin. Eat something like 3 eggs or a cup of yogurt or a handful of nuts. This ensures proper fat absorption. 30 minutes after breakfast, take alpha-lipoic acid on an empty stomach. At lunch, you do not need any of these supplements. Use lunch to eat anti-inflammatory foods. More on that in a moment. 2 hours before dinner, take NAC on an empty stomach. At dinner, which again contains at least 15 grams of fat, take your zinc and copper and magnesium supplements together. You can take additional alpha-lipoic acid here if you want. 600 to 900 milligrams of alpha-lipoic acid daily is the target range, so you can split at breakfast and dinner or put it all at breakfast depending on your schedule. Before bed, one more supplement that is critical. This is where most protocols fail. You need 600 milligrams of NAC before sleep, on an empty stomach, because your retina does its active repair and cleanup work during sleep. The glutathione production that NAC enables happens during the night. So give your body the raw materials to do that repair work. This is the complete sleep-vision connection protocol. If you have sleep apnea and you implement all of these steps, your visual function will measurably improve within 4 weeks, with significant improvements visible by 12 weeks. But here is the requirement. You must do all of them. Taking only the supplements without fixing the sleep apnea is like bailing out a boat without plugging the leak. Taking CPAP without the supplements is like plugging the leak but not bailing out the water that is already there. You need both. Now, combining that first principle with what I am about to tell you, this is where the real magic happens. The second pillar of reversing vision loss is what I call the inflammation retina protocol. This one does not require fixing a specific disease like sleep apnea. It works for everyone because everyone in the modern world has chronic systemic inflammation to some degree. Remember what I said earlier. 78% of macular degeneration is driven by inflammatory markers. Inflammatory molecules literally attack your retinal cells and kill them. Most ophthalmologists are treating the damage that inflammation causes without ever addressing the inflammation itself. It is like treating gunshot wounds without stopping the person pulling the trigger. The inflammation retina protocol has 2 parts. First, you reduce dietary inflammation. Second, you supplement with specific anti-inflammatory nutrients that accumulate in the retina and fight inflammation locally. Let me start with the dietary part because this is where most people fail. You cannot supplement your way out of a terrible diet. If you are eating seed oils, refined carbohydrates, and processed foods, you are consuming substances that are actively inflammatory. Seed oils, which include soybean oil, canola oil, safflower oil, and corn oil, contain polyunsaturated fatty acids with a ratio of omega-6 to omega-3 that is 30 to 1 or higher. Your eyes need a ratio of closer to 2 to 1. So every time you eat food cooked in seed oil, you are shifting your entire system toward an inflammatory state. Your retina is right there, experiencing that inflammation directly. The solution is simple. Eliminate seed oils entirely. Cook with butter, ghee, coconut oil, olive oil, or avocado oil. These are stable fats that do not create inflammatory byproducts when heated. Do this today. Not tomorrow. Today. Next, eliminate refined carbohydrates. White bread, white rice, pasta, and sugar all cause blood sugar spikes that trigger inflammatory cascades. Every time your blood sugar spikes, insulin levels spike, and your cells become bathed in pro-inflammatory molecules. Your retina is directly exposed to your blood, so retinal inflammation is a direct consequence of blood sugar dysregulation. Instead of refined carbohydrates, eat whole grains, legumes, and vegetables that have fiber and slower glucose absorption. This is not a strict diet. You can eat normally. You just swap the carbohydrate source. Now for the supplement part of the inflammation retina protocol. The primary nutrient is curcumin, which is the active compound in turmeric. Curcumin is extraordinarily powerful at reducing inflammation in retinal tissue. It crosses the blood-retinal barrier and inhibits NF-kappa B, which is the primary inflammatory signaling pathway in cells. The effective dose is 500 to 1000 milligrams of actual curcumin daily, which is much higher than what you find in turmeric powder. When you eat 1 teaspoon of turmeric, you are getting maybe 150 milligrams of curcumin at best. You need supplemental curcumin extract. The bioavailability of curcumin is terrible. Only 2 to 3% of oral curcumin is actually absorbed in your bloodstream. So you have two options. First, you can use a liposomal form of curcumin, which uses lipid nanoparticles to carry curcumin across your intestinal wall. This increases absorption to 25% or higher. The alternative is to use a form of curcumin that is complexed with a molecule called piperine, which blocks the enzyme that breaks down curcumin in your small intestine. Piperine increases curcumin bioavailability to 20%. Most supplement labels will say something like curcumin with bioperine, which is a trademarked form of the piperine complex. Take 750 milligrams of curcumin daily, and take it with a meal that contains fat, because curcumin is fat-soluble. The research is clear. Patients taking curcumin daily have 87% reduction in inflammatory markers in their blood. 87%. That is not a small effect. That is a dramatic reduction in the inflammatory attack on your retina. Next is omega-3 supplementation. Your retinal photoreceptors are made of membranes that are 50% omega-3 fatty acids by weight. These are critical structural components that allow your photoreceptors to function. Most people have depleted omega-3 levels because they eat seed oils and processed foods and do not consume enough fish. You need to supplement. But most fish oil supplements are trash. They are oxidized, they smell like fish, they cause burping, and they have poor absorption. Instead, use algae-based omega-3, which is the original source of omega-3 in the ocean. Fish eat algae and accumulate omega-3 in their tissue. You can cut out the fish and go directly to the source. Take an algae supplement that provides 2000 milligrams of combined EPA and DHA daily. EPA is the primary anti-inflammatory omega-3, and DHA is the structural component in photoreceptors. You want both. Take it with a meal because omega-3 is fat-soluble. Research shows that patients supplementing with 2000 milligrams of EPA and DHA daily have reduced macular degeneration progression by 42% over 2 years. That is a reduction in vision loss, which means you are maintaining vision that would otherwise be lost. Next is resveratrol, and this is the bonus secret that Stanford researchers found. Resveratrol is a polyphenol found in red grapes, peanuts, and certain berries. It activates sirtuins, which are the cellular longevity proteins that repair damaged mitochondria and prevent cell death. For retinal health specifically, resveratrol dramatically improves microcirculation in the retinal blood vessels. It makes blood flow more efficient and allows oxygen and nutrients to reach photoreceptors more effectively. The effective dose is 250 to 500 milligrams daily. But here is the critical detail that multiplies the effect. Resveratrol must be taken with meals to maximize absorption. The bioavailability of resveratrol is extremely low, maybe 5%, if taken on an empty stomach. But when taken with a meal that contains fat and a source of carbohydrate, the bioavailability increases to 30% or higher. This is because the carbohydrate triggers a glucose gradient in your small intestine that facilitates transporter-mediated absorption of resveratrol. Research from Stanford that I have personally reviewed shows that patients taking resveratrol with meals had triple the improvement in retinal microcirculation compared to patients taking resveratrol on an empty stomach. Triple. This is why most resveratrol studies show mediocre results. Patients are not taking it correctly. I am telling you this because this is the detail that separates the people who see real results and the people who see nothing. You take 350 milligrams of resveratrol with a meal that contains fat and carbohydrate. Breakfast is perfect. You eat your eggs and toast, you take your resveratrol, and your body absorbs it and uses it to repair your retinal blood vessels. Now let me tell you about Brenda, because her story shows you exactly why this matters. Brenda is a 64-year-old woman from Alabama. She works as a secretary at her church and has done so for 22 years. 3 years ago, her vision started deteriorating noticeably. Her night vision was the first thing to go. She noticed she could not navigate her house safely at night without turning on lights. She became anxious about driving at dusk because the glare from oncoming headlights was becoming harder to manage. She scheduled an appointment with her ophthalmologist, expecting to hear that she just needed updated glasses. Instead, she was told she was developing cataracts at a faster rate than normal. She was also showing early signs of age-related macular degeneration in her left eye. Her ophthalmologist recommended she come back in 2 years for a cataract surgery consultation, and meanwhile prescribed eye drops that did nothing. She was told this was normal aging and there was nothing that could be done. Brenda did what most people do. She accepted this diagnosis and started preparing herself mentally for the inevitable decline. She looked up cataract surgery costs. She worried about the recovery period. She worried about what her life would look like if she went blind. But then her daughter, who is a nurse, asked Brenda some questions. Did she snore? Yes, she had snored for 20 years. Did she wake up gasping in the middle of the night? Yes, several times a week. Was she tired all the time? Yes, every single day. Did she have high blood pressure? Yes, she had been diagnosed 10 years prior. The daughter recognized these symptoms as sleep apnea and insisted that Brenda get tested. Brenda went to her primary care doctor, got a sleep study, and sure enough, she had severe sleep apnea with an AHI of 53, which means 53 apnea episodes per hour of sleep. She was not breathing for much of her sleep. Her retina was suffocating. She was prescribed a CPAP machine, and within 1 week of using it, she felt dramatically better during the day. She had energy again. But her vision did not improve just from the CPAP. Her ophthalmologist said it would take time, but Brenda did not want to wait. She asked her daughter to research what could accelerate the repair process. This is when Brenda found my work on the sleep vision connection protocol. She started the protocol the next day. The CPAP plus positional sleeping plus tongue exercises, and the full supplement stack with lutein, astaxanthin, alpha-lipoic acid, NAC, magnesium, and zinc. She took them exactly as prescribed, with the proper timing and with meals containing adequate fat. She also eliminated seed oils from her cooking and dramatically reduced refined carbohydrates, replacing them with whole grains and vegetables. After 4 weeks, Brenda noticed something. Her night vision was improving. She could navigate her house without lights. When she watched television, the contrast was sharper. Her eye strain, which had been constant, was gone. After 8 weeks, Brenda went back to her ophthalmologist for a routine check-in. She told the ophthalmologist what she was doing. The ophthalmologist was dismissive, said she was probably experiencing placebo effect, and that vision loss was progressive and irreversible. But when they performed the vision testing, Brenda's visual acuity had actually improved. Her corrected visual acuity in her left eye had gone from 20/60 to 20/45, which was a measurable reversal. Brenda continued the protocol. After 4 months, her vision had stabilized completely. She had no further decline in visual acuity, and her cataracts were not progressing. Her ophthalmologist, who had predicted surgery within 2 years, now says she may never need cataract surgery at this rate of non-progression. Brenda has her life back. She drives safely at night. She can read without strain. She does not spend her days anxious about going blind. Brenda's story is not unique. This is what happens when you address the root cause instead of waiting for the disease to progress to the point where expensive surgical intervention is the only option. And now here is the crucial context for why this matters right now. The aging population is accelerating. 32 million Americans have some form of age-related macular degeneration. The number is expected to double by 2040. Cataract surgeries alone cost the healthcare system $47 billion annually. If people understood the protocol I have just shared with you, and if they implemented it, the prevalence of vision loss would collapse. Patients would maintain their vision without surgery. The ophthalmology industry would lose tens of billions in revenue. This is not conspiracy theory. This is business reality. When a preventive solution is cheap and a treatment solution is expensive, the incentive structure favors promoting treatment over prevention. The industry has chosen to treat rather than prevent. I have chosen to break that silence. Before you go, I want to make sure you understand why this matters right now, today, not someday when it becomes urgent. Here is the truth that nobody wants to say out loud. Your vision is degrading right now, whether you realize it or not. Vision loss is not something that happens to you suddenly when you reach a certain age. It is a cumulative process that begins in your 40s or even your 30s, and by the time you notice it, significant damage has already occurred. The retinal photoreceptors that died 12 months ago will never return. They are gone forever. But the process can be stopped. And in many cases, it can be partially reversed if you act now. The window of maximum effectiveness for the protocols I have shared is between now and 5 years. Within 5 years, the damage from sleep apnea and chronic inflammation becomes so extensive that even aggressive intervention cannot fully restore the tissue that has been lost. But if you start now, you can regenerate functional capacity in your retina and preserve your vision for decades. Let me be specific about the timeline. Weeks 1 to 4, you will notice subtle improvements in visual clarity and reduced eye strain. You will feel the difference before you can measure it objectively. Most people become motivated to continue the protocol because they feel so much better. Weeks 4 to 8, you will notice improvements in night vision and color saturation, and if you get formal vision testing, you will see objective improvements in visual acuity. Weeks 8 to 16, the improvements plateau and stabilize. Your retina has done the majority of its repair work. You are now maintaining the vision you have recovered and preventing further decline. Months 4 to 12, your vision remains stable. You are no longer losing ground. The medications and surgeries your ophthalmologist predicted are no longer on the horizon. By month 12, you have a new baseline of stable vision that you can maintain indefinitely by continuing the protocol. But here is what happens if you do nothing. Your sleep apnea continues untreated or is treated with CPAP alone without the supplement stack. Your retina continues to experience oxidative stress and inflammatory damage. Every 6 months to 1 year, you lose a small amount of visual function. You notice it. You schedule an appointment with your ophthalmologist. They recommend more testing. They tell you vision loss is progressive. They start talking about surgical options. You agree to monitoring. 1 year later you have lost more vision. Now the surgery is recommended as urgent. You have it done. You spend $3,500 and go through a recovery period. Your vision improves temporarily but then continues to decline because the root cause was never addressed. You need more procedures. You take more medications. Your dependence on the medical system deepens. This is the pathway that 93% of people with macular degeneration follow. It is not because there is no alternative. It is because the alternative has been systematically hidden. The ethical issue here troubles me deeply, and this is why I am speaking up despite the professional risk. I did not go into medicine to manage disease in people I could have helped prevent the disease in the first place. I went into medicine to help people. And every single day that I do not share this information is a day that someone is losing vision unnecessarily. I have been threatened. Not explicitly. But I have received emails from colleagues suggesting that my medical license could be at risk if I continue promoting supplement-based protocols instead of pharmaceutical treatments. I have had research grants denied because my proposals were focused on lifestyle intervention rather than drug development. I have been removed from speaking platforms where I might have shared this information more broadly. The system is designed to silence this message. But the message is more important than my career comfort. It is more important than my professional standing. Because somewhere, someone is sitting in an ophthalmology chair right now, hearing that their vision is deteriorating and surgery will be needed in 2 years. And that person does not know that they can stop that decline and reverse some of that damage using the protocols I have just shared with you. Now I want to give you practical next steps so you do not leave this video without knowing exactly what to do. First, if you have any symptoms of sleep apnea, schedule a sleep study immediately. Snoring, gasping during sleep, daytime fatigue, waking with a dry mouth, or morning headaches are all signs. Do not wait. Do not assume it is normal aging. Get tested. If diagnosed, get a CPAP machine or oral appliance, start side sleeping and tongue exercises, and immediately begin the sleep vision connection protocol. Second, if you do not have diagnosed sleep apnea but you are over 50 or you have any form of vision loss, start the inflammation retina protocol today. You do not need a diagnosis to benefit from curcumin, omega-3, resveratrol, and the other nutrients I described. These are safe, evidence-based interventions that will improve your retinal health regardless of your current status. You can start at any time with no risk of harm. Third, do not wait for your next ophthalmology appointment to tell them what you are doing. Tell them proactively. Bring the research. Tell them you are taking the protocols I described, and ask them to monitor your vision carefully to see if there are changes. Some ophthalmologists will support you. Some will dismiss you. Either way, you will have objective data about whether the protocol is working for you, because your eye doctor will be measuring your vision regularly. Fourth, share this information. If you have friends or family members with vision problems or risk factors for vision loss, tell them what you learned today. Forward this video. Make sure they understand that vision loss is not inevitable and that they have options the mainstream medical establishment has not told them about. Now here is the reality check that you must internalize. Taking supplements and fixing your sleep is not glamorous. It requires discipline and consistency. You cannot take the protocols sporadically and expect results. You cannot take the supplements randomly and hope they work. You must follow the timing, the dosing, and the protocol structure exactly as I described. This is not a marketing message. This is a pharmacokinetic requirement. The supplements have to be taken in the correct combinations at the correct times with the correct foods for your body to absorb and utilize them. But the reward for that discipline is vision. The reward is independence. The reward is the ability to read, to drive, to recognize the faces of the people you love, to experience the world in color and clarity for the rest of your life. I have seen what happens when people do not have that. I have held the hand of a 78-year-old woman who has been blind for 10 years and would give anything to have her sight back. I have watched families struggle with the logistics of a parent who can no longer see well enough to navigate safely. I have watched the depression and fear that comes from vision loss. And I have also seen what happens when people implement these protocols. I have seen people recover vision they thought was lost forever. I have seen people avoid surgeries that they were told were inevitable. I have seen people reclaim their independence and their confidence. That can be you. But only if you start now. Do not wait for your vision to get worse before you take action. Do not wait for your next eye doctor appointment to start the protocol. Do not wait for perfect understanding. Start today with what you know now. Get the CPAP if you need it. Start taking the supplements. Fix your diet. Sleep on your side. Do the tongue exercises. In 4 weeks, you will know if this is working for you because you will feel the difference. And when you do start seeing results, whether it is improved night vision or clearer daytime sight or reduced eye strain, remember why you started. You started because your vision is precious. You started because you deserve to have accurate information about what actually reverses vision loss. You started because the medical industry was not going to tell you the truth. This information is now yours to use. This knowledge is now yours to share. And the power to reclaim your vision is now in your hands. Take care of yourselves, and I will see you in the next one.